Matthew Crook, physician assistant at Summit Sports Medicine Orthopedic Surgery. The nice thing about orthopedics is we treat a little bit of everybody, especially this practice. We see everything from kids all the way up to geriatrics, so the full gambit of patients. Surgical cases are where I usually have the most experience, and I feel like I'm the biggest asset to the patient, so a lot of total joint replacements, rotator cuffs, labrums, any sort of knee arthroscopy, sports medicine. I've done a lot of everything. I was with a generalist for a long time, so I'm pretty wide spectrum as far as the patients I see. I was an athlete in high school, and I try to be one now, but so I had injuries, so I got to see orthopedics and physical therapy and everything firsthand, and I saw how much it helped me, so it was kind of nice to have that base. The big thing is that you have to treat each patient like an individual. They'll always surprise you. Things that you think are going to be a normal, just a knee pain thing, can turn into a lot more interesting thing. Their history gives you a lot of information, that and their mechanism of injury. Some things just fall into place and make sense, and other things you really have to dig on and try to figure out if this is one problem or a multitude of problems. Well, I have 2 Bernedoodles, so I have some really great dogs, and have a lot of fun with my wife, and we like to travel and stuff, and then maybe becoming at least a respectable golfer at some point. At this point, it's not really respectable, but I'm going to move forward with that. I try to be compassionate. Like I said, I was a patient before I was ever a PA. I've been on the opposite side of surgery, so I know how scary and it can be a real issue for people. You doing better makes me feel better about what I do and feel better about who I am. So making people better is just a goal.